Neomycin-Fluocinolone-Emol No. 65 cream is used to treat certain bacterial skin infections. It contains neomycin, an antibiotic that stops the growth of bacteria, and fluocinolone, a corticosteroid that helps reduce swelling, itching, and redness of the skin. It's important to note that this cream only treats bacterial skin infections and will not work for other types of skin infections caused by fungi or viruses. It's crucial to use this medication only as prescribed to avoid decreased effectiveness. When using Neomycin-Fluocinolone-Emol No. 65 cream, it's important to remember that this medication is for use on the skin only. Before applying the cream, make sure to wash your hands and clean and dry the affected area. Then, apply a thin film of the medication to the affected area as directed by your doctor, usually 2 to 4 times a day. After applying the cream, remember to wash your hands, unless you are using the product to treat your hands. It's important not to cover, bandage, or wrap the area unless directed to do so by your doctor. Also, make sure not to use large amounts of this medication or apply it more often or for a longer period than directed. Using more than directed will not make your condition improve any faster and will increase your risk of side effects. Additionally, this product is not recommended for use over a wide area of the body, and you should not use it for longer than 1 week unless directed by your doctor. Be careful to avoid getting this medication in your eyes or inside the mouth or nose. If this happens, wipe off the medication and rinse thoroughly with water. To get the most benefit from this medication, use it regularly at the same times each day. And if your condition does not improve after 1 week, make sure to inform your doctor. If you experience burning, irritation, or dryness of the skin, speak to your doctor or pharmacist. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Most people using this medication do not have serious side effects. Contact your doctor immediately if you notice any unusual skin symptoms or if your condition does not improve. Rarely, it is possible for this medication to be absorbed into the bloodstream, leading to potential side effects of too much corticosteroid. These side effects are more likely in children and in people who use this medication for a long time or over large areas of the skin. Tell your doctor if you experience any unusual side effects. A very serious allergic reaction to this drug is rare. However, seek medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so discuss any concerns with your doctor or pharmacist. Before using Neomycin-Fluocinolone-Emol No. 65 cream, make sure to let your doctor know if you are allergic to neomycin or fluocinolone, aminoglycoside antibiotics, or if you have any other allergies. It's important to discuss your medical history with your doctor or pharmacist before using this medication. This cream should not be used to treat an infection in the outer ear canal if the eardrum is torn. Using corticosteroid medications for a long time or over large areas of skin can make it more difficult for your body to respond to physical stress. If you are planning to have surgery or emergency treatment, or if you get a serious illness or injury, it's important to inform your doctor or dentist if you are using or have used this medication within the past few months. In rare cases, this medication may temporarily slow down a child's growth if used for a long time, so it's important to see the doctor regularly to monitor your child's height. If you are pregnant, this medication should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding. When using Neomycin-Fluocinolone-Emol No. 65 cream, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Be sure to consult with your doctor before starting, stopping, or changing the dosage of any medications. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help by calling 911. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important to only use this medication for the condition it has been prescribed for, and not share it with others. Do not save it for later use or use it for a different infection without consulting your doctor. If you happen to forget a dose of Neomycin-Fluocinolone-Emol number 65 cream, use it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. Make sure to store Neomycin-Fluocinolone-Emol number 65 cream at room temperature and avoid freezing it. Keep all medications out of reach of children and pets. Do not flush this cream down the toilet or pour it into a drain unless you are specifically instructed to do so. When this product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.